Mild xanthelasma. Xanthelasma is a small yellow deposit of cholesterol on the skin, usually under the eyelids, which in some circumstances can result in a swollen red eyelid. However, in large lesions, direct closure can be difficult and contractions, ectropions and eyelid deformities may occur, which in layman's terms means that they can get so large or their placement is so that they start to deform the eyelid, hindering your vision and making closing of the eyelid difficult when they get to an extreme stage. When they get way beyond being a mild case of xanthelasma and become one where surgical intervention is the only option, then it's scalpel time and after. Skin grafts can be performed. Eyelid contractions may occur in the first few days after surgery, but also in the second half of the surgery, and eyelid contractions and ectropions may occur during surgical removal. The mild xanthelasma is characterized by small yellow plaques that are visible on the upper eyelids. The most common site of yellow plaque is the intermedial canthus, which can also be called outer medial or outer canthons or yellow skin xanthos. The difficulty arises if surgery is needed, is that skin graft to cover the excessive damage to the skin have great difficulty staying in place on your eyelids, as they are constantly mobbing, whether normally or inadvertently in our sleep. Take action with regards to stopping them ever getting to the size where surgical intervention is necessary. Initially mild xanthelasma, over a couple of years can result in, for some poor folk, extreme xanthelasma plaques that deform their eyelids. Before they get to that stage, change your diet, check your cholesterol and stop them in their tracks and remove them for good with Xanthel, which is developed solely to target these cholesterol-laden skin cells and return your skin back to its healthy natural state. What causes and how to recognize mild xanthelasma? Although most patients have normal lipid levels, over 30% have lipid abnormalities in the upper eyelid. While most patients had normal lipid values in the upper and lower eyelids, in some cases they showed lipid abnormalities in the intermedial canal. Clinically, they are yellowish papules, plaques or nodules, and have a soft consistency that can be semi-firm or hard. Eruptive xanthoma is a small papule that appears on the skin surface and is sometimes accompanied by itching, tenderness. Although from the same medical classification, eruptive xanthomas are different in their formation than mild xanthelasma. Clinically, there are no main requirements for differential diagnosis, but mild Xanthelasma Palpebrarum, XP, can easily be diagnosed on the basis of clinical background. If the pathophysiology of the disease is not clearly understood, the lesions may be seen as the result of a combination of factors, such as the presence or absence of other diseases or a lack of evidence of an underlying cause. In cases that are not clear-cut, surgical excisions and histopathology should be performed. Examinations for mild xanthelasma. When examining the eye, the doctor should always turn the eyelid upside down to look for conjunctival involvement. In the diagnosis of melanoma, a systemic assessment of regional and distant metastases is required, but not usually in the case of pigmented lesions or mild xanthelasma. Mild Xanthelasma Palpebrarum, XP, has the potential to impede the ability of the eye to turn inwards at the lid edge, leading to irritation, redness and stringy white mucous membranes. This entropion, which normally occurs on the lower eyelid, causes the eyelashes to rub against the cornea and conjunctiva. It is not harmful, but in rare cases it can be an indicator of possible heart disease, so it is a good idea to have it examined by a doctor or dermatologist. If you have several environments covered by plaque-type skin lesion, it is called a spleen plaque. It's easily evident that mild xanthelasma has the potential to get carried away and orbit towards an even bigger xanthelasma plaque, as well as expanding the potential for a lot of other issues that can be induced around the eye area. Get your diet under control and then remove the mild xanthelasma with a product called Xanthel. It's a recommended treatment for removing mild xanthelasma and stopping it in its tracks. Learn more about mild xanthelasma at xanthelasmatreatment.com or xanthel.com.